Good afternoon, everyone, and welcome to Vaccine Confidence Dialogues. And it's about being informed, reassurance, and choice. My name is Rudy Page, and I'm very pleased today we have with us Bishop Francis Waihenya from both Kenya and the UK. And our subject today will be servant leadership for community well-being. Good afternoon, Bishop. How are you?
Good afternoon, Rudy. I'm well, thank you.
Great, great.
Yeah.
So tell us about your COVID journey and its impact on yourself and family.
Let me just start by saying, as you have said, my name is Bishop Francis Waihenya. I live in Oxford, and I'm both in the UK and Kenya. I am presiding bishop of Household of Faith Ministries, which is a Pentecostal and charismatic church in Kenya with several congregations. And here in the UK, I'm involved in Global Alliance of Churches Association, which is an umbrella body for churches and ministers. At the beginning of this year, I started the year with COVID infection. One Monday morning, I was called to be told that one of my colleagues has tested positive, and because I was with him in the course of the week, I decided to go for a test. And I went for a test and turned out positive. And that is how I started my isolation journey from the first week of January. It wasn't very nice, and I must admit that personally, it hit me quite hard because both me and my wife were in isolation, but I was hit harder than my wife. And thank God, because I was able to get help from her. So the first week was quite a challenge because I went through a very painful experience with excruciating muscle pain and a constant gasping of breath. I didn't think it's going to be such serious, but then it knocked me flat on my back all the month of January and half the month of February. And when I was experiencing fever, severe nausea, and lack of appetite. In the first 2 weeks, I lost 5 kilos, which was quite substantial. And the virus nearly rendered me useless. And everything I did was a struggle, including rolling over in bed. But I thank God for my wife for supporting me through this period, although she was also infected, and both of us were in isolation. And of course, Solomon's words of wisdom in Ecclesiastes 4:9 to 12 become a reality to me. Two are better than one. So when one falls, the other one can lift the other in support. And that is exactly what happened. I was quite concerned because of my breathlessness, and because one of the things I was so scared about, I didn't want to go to hospital because I was very scared of going to hospital. I wasn't able to benefit from the isolation fund. There were so many excuses about it, so I applied but was rejected, both mine and my wife's. I think a number of people have gone through the same, so we never benefit out of that at all. So what I was so concerned about was my oxygen levels. Luckily, We had an oximeter, and we were able to monitor our pulse and our oxygen levels. And they weren't so discouraging. So at least we had a bit of hope. I finally talked to my GP, and he referred me to hospital to go and see a doctor, at least to do some little examinations. And I drove myself to hospital. I saw the doctor, and by God's grace, I went in and out of hospital. The doctor gave me a sigh of relief when he said, well, my oxygen levels are quite okay. But he told me I would take a bit of time to go back to where I originally was. My other challenge was that I didn't let my family know. All my children are in Africa. My mother and my father. My father is nearly 100. My mother is in her 90s. And I didn't want them to know because my father has a condition of high blood pressure, and would have affected him a lot if he knew about that. My mother has been diabetic for the last 40 years. And so again, it would have been quite traumatic for her to learn about it, because when you hear of COVID, you think of death. I have a younger brother who has type 2 diabetes. And so again, I didn't want them to know. So we deliberately refused to tell our children, so that the information doesn't leak to our parents. We kept it to ourselves until we tested negative after some time. Well, actually, I told my father last week. That's when I called him to give him the news, because I knew now I would be okay. So what I felt about my journey is that we all need to do what we need to do to avoid getting this virus. It is, as a matter of fact, a killer. And you do not want yourself or anybody near a member of your family or neighbor get involved in it. So if we are able to observe the COVID protocols, that will help us a lot.
Okay.
And the other thing I was also during that time, because it's a time I've never spent such a long time in the house, and so I was affected. I had anxiety, and of course, as a servant of God, I was looking at a few things, and I was looking particularly at Psalms 91. They are the promises of God that He has made to His own people, and I was wondering, how does that now interpret for me when I'm in this kind of condition? And why should I continue suffering like this when there are promises that I shouldn't? And I was reminded about Hebrews chapter 11, which is, I always say it is not concluded. And many brethren will be included in the heroes and heroines of faith in that chapter. And so when I was thinking about it, I saw the witnesses, God's witnesses, how they suffered and how they died. And I asked myself, I haven't even witnessed anything close to that. And they faithfully went through it. And so I believed, and I had hope, and I was praying that I will go through it. And as a family, we will go through it.
So has the vaccine been a challenge to your biblical principles?
I wouldn't say the vaccine has been a challenge. I would say no. Because as far as I am concerned, vaccine is preventative medicine. That is the way I would like to look at it. And I think of, I think it was Erasmus the Dutch philosopher who said that prevention is better than cure.
Mm-hmm.
And so when I think of a vaccine, I think of a vaccine as preventative medicine, and I have a duty to prevent myself.
Yes.
I know scripture doesn't say anything about vaccinations, since most of the scripture was actually availed before the vaccinations were not there when the Bible was written. But I would like to look at myself in the context of 1 Corinthians chapter 4, verse 2, where Apostle Paul says that we are stewards of we are stewards of God. And so whatever God has given unto us, we are the stewards, we are the managers. And one of the things God has given me is my body.
Exactly.
So I have a duty to seek ways and means to prevent my body from harm.
So what are your thoughts on the various interpretations, and why are there such variants?
Well, I think to begin with, as I have said, if I may start from there, when people don't understand why people get sick and why they go through such things, I remember Apostle Paul speaking to his son, spiritual son Timothy, in 1 Timothy chapter 5, verse 23, and he says, use a little wine because of your stomach and your frequent illnesses. Now, this is clearly an exhortation to use preventative medicine. And so the debate of and various interpretations that people have, I believe that the individuals and some religious leaders with, in quotes, questionable interpretation of their religious practices are the ones who are opposed to vaccination. But I'm convinced that vaccination is a powerful tool of prevention of infectious diseases, some of which, of course, are extremely dangerous. And I believe most of the differences that now emerge from how vaccines are made. I think that's where mostly the differences are emerging when people think about how the vaccines are made. For example, there are people who feel that vaccines are morally compromised because of their connection with the act of abortion. And this is a concern that is making people have these differences. Yes.
So the question would be then, is what role does wisdom play in seeking to be informed and reassured that the vaccine is safe?
Well, I think, as I said earlier, because we are made in the image of God, when God commanded mankind to be fruitful and multiply, he left it to us to decide how to do this. And so it is clear that we cannot be fruitful and multiply unless we are healthy. We must then use our minds, we must use our power of thinking to decide, how do we preserve our health? There's a lot of scientific research which has been produced regarding preventative medicine. And we need to use our intelligence that God has given us to go beyond the raw nature which God created, because God created that raw nature. But what do we do with it? We need to preserve the health which we need to obey God's commandment. But of course, I don't believe that COVID-19 vaccine will be the ultimate solution for this problem, because we could see evolution of the virus creating a mismatch between virus and vaccine. But we are intelligent people who God has created, and we need to respond to this.
Yes. So what do you think this pandemic has taught us about our mental health and our spiritual well-being?
Well, a number of things. For me personally, I feel when I was in isolation, for example, people who are isolating or need to be provided with information. Because, and there are so many people now working from home. looking after themselves, and how do they manage their anxiety? That is one question that I was asking myself, so that they can sustain hope and they can have confidence. And I think it is important to look at, for example, we are on the screen, for example, for a very long time. This pandemic has put us on our laptop screens, our mobile phone screens for a very long time, which has resulted from, of course, risk of burnout. It has affected people's eyes health, which has, of course, led us to increased risk of headaches and migraines. And isolation and lockdowns has also led people to not taking fewer breaks away from their laptops. Of course, the work environment out there, people are likely to chat with other people and do other things, take breaks, have interactions, go to meetings. But when we are online and on social media and revolving around that, then we are staying home for very long hours. This is very likely to interfere also with our sleeping habits.
Yeah.
And I also believe that having good sleep is important to my individual mental health and then my overall health, of course, as well as the community well-being. Not everyone who overcomes infection returns to a clean bill of health. So some of the people are likely to continue lingering with complications.
Yeah, long COVID, as they call it.
Yes.
So how can individual resilience and renewal be translated into community well-being, as you've just mentioned?
Well, for me, COVID-19 epidemic has posed an acute threat to both individuals and family well-being because of the challenges that are related to social disruption, such as financial insecurity. There are so many people who are financially insecure. There are people who are burdened with caregiving. There are people who are confined, confinement-related stress. They are going through it because some of them are also crowded now. And there are also changes to the family structures and routine. All these are the consequences of these challenges are likely to be long-standing for a long time. Because actually, the way we also spread the risks of our structures and processes in our family systems has also changed. And it's so therefore critically important that we kind of consider family-centered approaches, which would include short-term and long-term, kind of evidence-informed mental health practices when we are trying to address these challenges. Because if we actively cultivate social support and behaviors that will help us to reach the most vulnerable people, this can have a very powerful resilience promoting effects. So in order to overcome these challenges, I personally feel that we need to be a bit innovative and try to experiment some new approaches that can regain productivity for individuals and which will translate to our community well-being.
Great. Thank you for that. And it's been great that you've been able to join us today.
Yeah.
And certainly look forward to your further contribution on the various forums coming up over the next few weeks.
Thank you.
So that was Bishop Francis Waihenya, and thank you very much and good day.
Thank you very much, Brother Rudy, and have a good day too.
Thank you. Bye.
Bye.